Hi, I'm Tim, I'm an osteopath, and today we're going to talk about intervertebral discs. Intervertebral discs are located between the vertebrae as we go up and down the spine, and you can see here vertebrae, disc, vertebrae, disc, and these travel the length of the spine, and that basically shock absorbers. What I'm going to do is I'm going to bring in a couple of props, a couple of my favourite donuts, and show you exactly what I mean. So with my favourite prop here, a donut, I'm going to explain just really what an intervertebral disc is. So it has two parts, and the outside is called the annulus fibrosus, and this is a tough ring that surrounds the disc, or donut in this case, and keeps the content, which you can imagine would be the jam, which we call the gel, inside. And that's what keeps a nice, plump, donut-shaped. So the second part of a intervertebral disc is the contents, and that's called the gel, or nucleus propulsors. And this is a very tough gel, and this acts to help retain the shape and consistency of the disc, and also helps keep the vertebrae apart. Yeah. So basically, it's acting as a cushion and a stabilizer for the spine. So now we're going to talk about the disc and some of the things that happen to discs. So the first thing is, naturally we will get older, and as a passage of time our disc gets older, and essentially that is subjected to wear and tear. So you've probably heard that from your doctor, wear and tear. You may have also heard the term degenerative disc disease, and you may have also seen comments like a dehydrated disc or loss of disc height. And this is all really where the gel, or the jam, inside my donut has kind of evaporated and reduced down. So therefore the height then becomes less between each vertebrae, because it's not held apart by a nice plump disc, and that's reducing it. That puts both pressure on the facet joints at the back and on the spinal cord and potentially the nerves to give some nerve compression. So probably the most common lay term and what people talk about are slip discs. And medically these are referred to as herniated or prolapsed discs. And this is when the disc itself, we spoke about the tough outer ring called the annulus fibrosus on our donut and on our disc. This is when it weakens, so it loses its shape. So if you see the vertebrae here, and we refer to our donut, it was a perfectly, basically symmetrical ring. But when you get a weakness, then the disc will bulge or prolapse. And this will then push, if you imagine the black bit is where the disc is bulging of my pen, and that's going to impinge on a nerve. And that's often what we call a trapped nerve, or pressure from, pressure on the nerve from a disc. And that will often result in lower back pain, localized in the lower back, and the term sciatica will often be used because it's basically pushing on the sciatic and trapping the sciatic nerve. So just to have a bit of fun with our donut and to further explain the whole concept of prolapse, herniated or slip discs, if you imagine my pen here is the nerve, and there we have here at this point a lovely even fat donut or disc, and it's not impinging on the nerve. However, if the disc starts to bulge, what we would see here is if the disc starts to bulge, it's now losing its shape, and it's now pushing and impinging on the nerve here, and that would create the sciatica we were talking about. The other concept is, of course, we spoke about the gel inside, and we spoke about that dehydrating. But the other thing, when we load our spine with particularly heavy lifts, we then can actually cause severe damage to the disc. And this will be shown like this, where we would push and push and push and push, and can we just see the gel has broken through the annulus fibrosus ring, and that gel will most possibly attach or surround the nerve root, and that will create a significant amount of pain and sciatica. So I hope you enjoyed watching the video and found the content useful, and if you did, why not share it?